Cardiovascular drugs. The following will be a review of the information not covered in the previous videos on this material. Calcium channel blockers. There are two types of calcium channel blockers. Non-selective calcium channel blockers will decrease heart rate and contractility, as well as being vasodilators, which decrease total peripheral resistance. Selective calcium channel blockers are strong vasodilators, but have little effect on heart rate and contractility. Calcium channel blockers inhibit the influx of calcium in the arterial smooth muscle, and this results in vasodilation. Through this action, calcium channel blockers decrease total peripheral resistance, decreasing the workload on the heart. Remember, if there is a greater resistance in the peripheral vessels, there is greater pressure, and that means the heart has to pump harder against the resistance. Calcium channel blockers are prescribed to treat hypertension and angina. Nitrates. Another drug class that decreases total peripheral resistance by vasodilating peripheral vascular smooth muscles is nitrates. Nitroglycerin is one of the most common nitrates. The result is the same. Vasodilation decreases total peripheral resistance, decreasing blood returning to the heart, decreasing the workload of the heart, and decreasing the oxygen demand. Therefore, this becomes an effective treatment for angina and myocardial infarction. Rapid peripheral vasodilation results in inadequate blood distribution that can result in dizziness, fainting, and headaches. Diuretics. Diuretics are a class of drugs that inhibit the reabsorption of sodium and chloride in the kidneys, resulting in an increase in excretion of fluid. This lowers blood volume and lowers blood pressure. They are used most commonly to treat hypertension and edema. The three classes of diuretics are thiazides, loop diuretics, and potassium sparing. Thiazides act in the early distal convoluted tubule, inhibiting the reabsorption of sodium and water, which results in fluid excretion. Loop diuretics act on the loop of Henle, again inhibiting the reabsorption of sodium and increasing fluid excretion. Some potassium-sparing diuretics act on the late distal convoluted tubule. Some inhibit aldosterone. Remember that aldosterone is a mineralocorticoid that causes sodium retention, and hence water retention. Thiazides are the first choice of treatment for hypertension, but loop diuretics are more potent. Potassium sparing are generally used in conjunction with another diuretic. Other cardiovascular drug classes. Antiarrhythmic drugs are drugs used to restore cardiac rhythm. Glycosides have a positive inotropic effect, and they increase cardiac output. They are used in the treatment of heart failure and arrhythmias. Alpha-1 adrenergic blockers bind with alpha receptors on peripheral blood vessels, preventing vasoconstriction. The result is vasodilation. ACE inhibitors are angiotensin-converting enzyme inhibitors. Recall that angiotensin 1 is converted by angiotensin-converting enzyme to angiotensin 2. Angiotensin 2 has multiple effects. It stimulates the release of norepinephrine, causing vasoconstriction and increasing total peripheral resistance. Angiotensin 2 also stimulates the reabsorption of sodium in the kidneys, increasing fluid retention. Angiotensin also stimulates the release of aldosterone, an antidiuretic hormone. The effect is to increase fluid retention. The result is an increased blood volume, an increased peripheral vascular resistance, which increases blood pressure. ACE inhibitors inhibit angiotensin converting enzyme, and the result is less angiotensin II formed. This increases fluid excretion and decreases peripheral resistance. Quiz yourself. Which cholesterol-lowering drugs are associated with exercise-induced myopathy? Fibric acid derivatives, bile acid resins, statins, nicotinic acid, cholesterol absorption inhibitors. Statins. Keep in mind that despite this side effect, they are not shown to inhibit exercise performance. Which of the following is not true regarding beta blockers? Beta blockers bind to beta-1 receptors on the heart, which results in a decrease in heart rate and contractility. Beta blockers are used to treat hypertension, angina, heart failure, and myocardial infarctions. Beta blockers decrease resting heart rate, but do not impact exercise heart rate. Cardioselective beta blockers preferentially bind to beta-1 adrenergic receptors on the heart. Beta blockers decrease resting heart rate but do not impact exercise heart rate. Beta blockers impact both resting and exercise heart rate. It's unlikely you will increase exercise heart rate in an individual on beta blockers above 120 to 130 BPM. Which of the two drug classes decrease peripheral vascular resistance by vasodilating? Beta blockers, nitrates, statins, selective calcium channel blockers, glycosides. Nitrates and selective calcium channel blockers. Which of the following is true about diuretics? Diuretics increase blood volume by increasing urinary fluid retention. Diuretics impair thermoregulation due to their initial effect on increasing peripheral vascular resistance. The main action of diuretics is to stimulate the reabsorption of sodium in the kidneys. Diuretics are most commonly used to treat angina and myocardial infarctions. Diuretics impair thermoregulation due to their initial effect on increasing peripheral vascular resistance. They decrease blood volume by increasing urinary fluid excretion. They accomplish this by inhibiting the reabsorption of sodium and chloride in the kidneys, and they are most commonly used to treat hypertension. Which of the following drugs are not matched appropriately with their actions? Glycosides increase cardiac output. ACE inhibitors increase fluid excretion and lower blood pressure. Antiarrhythmic drugs restore cardiac rhythm. Alpha-1 adrenergic blockers vasoconstrict. Alpha-1 adrenergic blockers vasoconstrict. Alpha-1 adrenergic blockers bind to alpha-1 receptors on vascular smooth muscle, blocking vasoconstriction and resulting in vasodilation. Which of the following is not true of calcium channel blockers? Calcium channel blockers are vasodilator drugs. Calcium channel blockers inhibit the influx of calcium in arterial smooth muscle. Calcium channel blockers cause vasodilation. Calcium channel blockers increase total peripheral resistance. Calcium channel blockers are prescribed to treat hypertension and angina. Calcium channel blockers increase total peripheral resistance. Calcium channel blockers decrease total peripheral resistance by causing vasodilation.